For the triple negative, it's a little different. I use the PREDICT model. And if the survival benefit isn't a few percent better for an anthracycline-taxane regimen, like dose-dense doxorubicin and cyclophosphamide followed by paclitaxel, either 12 weeks or whatever your preference is, or docetaxel, or a TAC regimen, I look to see if there's a few percent benefit for the anthracycline compared to less aggressive regimens like docetaxel and cyclophosphamide, the TC regimen. And if it's a few percent better and cardiac function is good, and the patient has good longevity, especially in the 5-year, because we're talking now about recurrences in 5 years, I recommend more aggressive therapy. And older people tolerate it reasonably well. It's interesting, AC, at least in one of our trials with the Alliance and CLGB years ago, is very well tolerated. And about 80-90% of patients who are 65 and older got through 4 cycles of it. So you can do that. And then the taxanes worry me, because in older people, giving weekly paclitaxel, which is almost always going to be associated with some neuropathy at 12 weeks, is concerning. So lately, I've started, many of my colleagues, we'd like to see some more data, utilizing little cold gloves and booties that you can put on your hands and feet. Just like years ago, we showed that putting ice chips in your mouth for women and men with colorectal cancer getting fluorouracil diminished stomatitis. This cheap therapy for one of the worst side effects of chemotherapy, which is chemotherapy-induced peripheral neuropathy. One of the worst side effects, especially in all ages, but especially in older people. I think it helps. It's anecdotal, and I know some people are following up at some early exciting trials, and it's cheap and can work very well. So I think that you've got to be concerned there. If not, I tend to use the TC regimen, or their role for using cyclophosphamide, methotrexate, and fluorouracil, the CMF regimen. My friends at Memorial love that therapy, and it's been shown in some older trials to be effective therapy. So I think that you have options, but maybe they're avoiding the anthracyclines is appropriate.